Okay, so I'm probably going to get going with my day today. I took the day off on purpose today because, again, I shared an earlier video about just losing a lot of hair, losing, just a substantial amount. And I really feel like this is a sign for me to go see a doctor. So, it's been a few years, like my energy levels have been up and down, and I'm trying to watch what I eat and everything. So I'm thinking, wow, this came on super fast. Like, I don't know, like less than 3 weeks of just, you know, s- being in a hotel. This is when it happened. Being in a hotel, I was in the shower like the second day, and I noticed a lump in the shower, and then it's not going away. And then last night I was at work, and I just felt like the pain was there and it wasn't going away, and I felt itchy, like just, not in like a rash way, but just like it bothering me and just, keep, scratching kind of thing. And these are all signs that you can have breast cancer. So, without any insurance, how am I going to do this? So, I made a call already this morning. And, if I didn't have already like this mentality of having good self care, I probably would not be taking care of myself today. It's really easy to get into a cycle of feeling like you have to work. And when you are in a situation of losing your home, you do need, two or three jobs to get the situation going that, it looks really good. You look like it's a really good opportunity to rent to you. You want everything in order so that you can get what you need. So it can be a cycle though where you can, try to get ahead of the game and cut your health so that you can work more. But because I do believe in self-care, I do believe it's important to put yourself first many times with your care. It makes more sense for me to not work today and say, you need to take care of yourself or you're not going to be able to work. So I made a call today and I'm like, which way do I go here without health insurance? And we talked about, because it had been so long since I went to the doctors, I am no longer at this office for primary care. And because I don't have insurance, their policy has changed. So it would be a different primary care provider, or it would be going to the hospital directly, or it would be urgent care. And I think urgent care is making more sense because they can do x-rays right there. So, and hopefully they can do a mammogram right there. So, and then I was doing a little research because this is all new to me. This is like, I don't know of breast cancer running in my family. But with abortion, a lot of women have had breast cancer later on because of abortion. And I'm not saying it's from that, but it's still there. It could be something that does happen to you. So without health insurance, I have that to deal with. And what will happen is I will fill out forms for financial assistance there and then a payment plan with whatever's left over. And even then, I can get help on that. So I'm not going to compromise my health with the lack of health insurance because health insurance, even when you work, I mean, they take a lot of money out of you each week to pay for health insurance. And I would just rather take the help and because it's something you can't control, like something like, cancer it will wipe you right out. So, physically and financially. So, the other thing too is where my son got bit by a dog. I'm still dealing with that. I now have to deal with the side of their insurance taking care of everything. And I haven't heard from these people. I did talk to one lawyer who asked if they have house insurance, and I have no idea. But with hearing the owner saying that they had a beagle when the report actually said that the dog was part pit bull, insurances don't like to cover that because many times those dogs are stigmatized as vicious when they're not all vicious. It's how you it's how you train them. a lot of times. But that would be maybe why the owner was leaning on the side of Beagle to make sure her insurance covers everything. So that I have to do today too, and make sure, you know, my kid, pretty sure that the Medicaid is still covering everything that he had done, and it's also retro too. If he needs more care, like, I don't know where this could go. He could have an infection for all I know down the road, and that would also need to be taken care of, or an allergy or something. You know, you don't know where a dog bite can end up, and hopefully he will be fine, because the dogs, was told at the last minute they both had their rabies shots. So, I mean, that was still pretty scary for my son. The last people we were with, they kept, you know, they had a dog, and I felt like they were insensitive to my son because they were bringing the dog next to him. And I said, he doesn't want your dog next to him. And I had to come right out and say it. Because that can be, you know, traumatic for a kid. It's not like it was provoked where he went up to the dog and tried to, you know, feed it, or a dog you don't know. He actually wasn't even doing anything, just riding his bike, and the dogs were not even seen. They came out from behind a stone wall. And so that was pretty traumatic. And, you know, there's some sensitivity there too with going through that. So, hopefully he will not be scared to ride his, you know, he's out riding his bike again, and hopefully he will not be scared of, you know, having dogs come out and bite him again when he's just riding his bike. But so this all falls under not having health insurance, which should never stop you from getting the care that you need. All right, so I am off to take care of myself today and put work aside.